Lauren Stewart. She is from Americans for Prosperity. And, look, I guess it's nice. It's nice, Lauren, right, to think about, hey, let's just open up the floodgates and bring everyone in and offer them all kinds of free stuff. And, hey, I mean, it's a wonderful sort of altruistic thing to do. But then there's this other little thing called reality. And I think reality is called reality for a reason. I mean, is there any hope to this idea that we could just give healthcare for free to everyone?
No, simply put, absolutely not. There is no free lunch in healthcare. And when Kamala Harris talks about Medicare for all, what she's really talking about doing is empowering insurance companies. And at some time she'll say, let's get rid of private insurance. A Medicare for all policy actually emboldens private insurance. All the power that they have right now in American healthcare, they will have all of the power in American healthcare. So what this looks like is similar to what you can ask people on Medicare now, ask people on Medicaid how their healthcare is. A good percentage, nearly 25% of doctors in the United States don't take Medicaid patients. In some areas of the country, it's 40% of the doctors in the area do not take Medicaid patients. So these people don't have real access to healthcare. They pay a good amount even still. And, this is a good example of what a fully government run healthcare program looks like. Also, she talks about it like it's this fantastic thing, and it is the complete opposite direction of what voters and patients in America are saying they want with their healthcare. They want more access, they want more options, and they don't trust the government is the right person to do that. They want to make the decisions for them and their family and their unique healthcare needs. I mean, a one size fits all pair of pants would not work for our country, and that's what they're trying to do with healthcare.
Yeah, no, totally understandable. I know you've spent a lot of time and you do a lot of research on this in this field specifically, and you've come up with what you call the personal option. And by the way, people can go check that out at personaloption.com. But I think it's interesting to talk to somebody like you because you've done the due diligence to come up with some kind of alternative. Walk us through that alternative. What would be the personal option? So if we're not going to do, Kamala Harris's plan, and let's hope we're not. What can we do that, by the way, is better than what we've got right now? Because I think universally people will tell you that healthcare is lousy and the inflation is extraordinary. I mean, the laundry list of problems goes on. How do we fix it?
So I'm so happy you asked that question. I'm coming to you here from our Americans for Prosperity Montana field office. And the reason that's relevant now is Senator John Tester was the deciding vote on the passage of Obamacare and the Affordable Care Act. So things like the personal option, things that we're advocating for on Capitol Hill, increasing access, increasing options, empowering patients, not insurance companies and not the system, were really hit in the gut when the government tried to really insert itself in healthcare. And that's what happened with the Affordable Care Act. Now, a lot of the Affordable Care Act is, the subsidies have been enhanced so far that a lot of folks are getting their coverage. They're not getting health care. And I want to make that very clear that just because you have health insurance, whether it's through the ACA or anything, you do not have access to health care. And I think we can all say that if we've tried to get a doctor's appointment quickly or gone through our insurance. But the percentage of people on the Affordable Care Act now who are paying nothing for their health insurance said that they would not enroll in the ACA subsidies if they even had to pay $25 per month. So this is a terrible product that, folks like Kamala Harris and the Democrats keep driving. I mean, they literally can't give it away. So the personal option is the counterpunch to things like Medicare for all, to things like the public option, because we think that healthcare is personal. We know that healthcare is personal. It's the well-being for you and your family. So it should be personal in regards to who gets to make the decisions. It should not be the government. It should not be insurance companies deciding whether or not you can go see that particular massage therapist for your sciatica that creeps in and is debilitating, right? It should not be insurance companies or the government determining where you can deliver your baby when you're pregnant. So this is the personal option. What does it look like in policy sense? We'll get wonky, but we'll keep it kind of cool because I actually do think the personal option.
I'm with you.
Yeah, that's my party trick is making healthcare cool. Is is Uberizing healthcare, you know? So when we think of things quite literally like direct primary care, that's concierge care that right now the people in Hollywood have access to, and they wouldn't accept anything else. The only reason that more Americans don't have access to concierge care and direct primary care is government policy and antiquated rules in the IRS that say that they can't. Health savings accounts, which are an incredible tool for healthcare. Think of it as a 401k for your healthcare. You're able
Mhm.
to put away pre-tax dollars and save them for qualified medical expenses. Well, what's a qualified medical expense? A lot these days. You can go on Amazon.com. They have an HSA store, things like cold medicine, allergy medicine, copays, prescription drugs. Right now, only 10% of the population has access to it. Why? Because the government says they have to be tied to high deductible plans and employee sponsored health insurance. So if you're an independent contractor or say maybe a small business owner who can't provide these large scale insurance plans for
Mhm.
your businesses, you can't have a health savings account and your employees can't either. And then finally, things that are extremely favorable is removing barriers to telehealth. That's one great thing that came out of the COVID pandemic, and one great thing that's very favorable to patients. We need to make those provisions and the loosening of restrictions on that
There's a
fantastic
lot of bureaucracy
innovation
there,
permanent.
right?
Exactly. Yeah,
Just to
the
jump in.
innovation's there. The
Well, the
innovation's there,
innovation's
the
there, but there's
bureaucracy blocks it.
bureaucracy because I've seen it myself. I live outside of New York now, and it's like, whoa, we can't talk to you via the medicine thing unless you drive over the state line. And I'm like, seriously? But that's again the bureaucracy. Like they're only licensed in certain places, and they're not licensed outside of the state of New York. And I wonder if there's just a better way to deal with that and get through all that so that we can be providing more care to more people, especially in cases where you don't actually physically have to be present.
Absolutely. Last week we did our Scoops and Solutions Healthcare Week where we had folks imagine if healthcare could be like your favorite gourmet sundae bar instead of just plain vanilla. You could have any flavor
Mhm.
ice cream that you'd like based on your mood, based on your need that day. Maybe it's we had a health saving spiked hazelnut flavor. We had a telecare cookie crunch. We really went in on it, but it was to illustrate all the different innovations that are out there and being blocked. And during that week, we actually brought two incredible direct primary care doctors to Capitol Hill to explain their model to lawmakers. Now, both of these folks had different direct primary care models that worked perfectly for each of their communities. They both live in fairly rural areas, but they're able to provide prescription drugs at 90% cheaper than going through insurance. They're able to treat your cancer for free. And it is absolutely mind-boggling, right? Folks would hear that and be like, "Well, that's crazy. If you have a direct
Well, like
primary care
how?
doctor."
Yeah. I mean, really and
Yeah,
truly, like how? What are
yeah,
the workarounds there? Is there just so much sort of graft and middleman
yeah.
bureaucracy that's costing so much?
Yeah,
Yeah.
neither of them take insurance. That's how they're able to do it. They're able to purchase their drugs wholesale. There's these resources are out there and exist. Unfortunately, the incentives are not there for direct primary care doctors to do this, but we're starting to see more of a shift away from traditional medicine, away from doctors being in this kind of like thankless large hospital
Yeah, they
situation
don't
where
like it
more of
either.
no, where more of their job is paperwork than treating patients and giving the highest quality of care. I mean, we're walking through the Capitol with these folks and they're like, okay, hold on. I have a call from my patient. They take the call. They say, okay, let's lower your dose. If you're not feeling good, let me know tomorrow. And
Mhm.
that's how they're able to administer care. That is such high quality care. That would change health outcomes for our country fundamentally. And I don't need to
Yeah,
tell
but
you this, but
okay,
we
so
spend a lot.
I'm a little bit of one of those Hollywood people myself. I mean, I do the concierge thing, and I have a
It's so
wonderful
great.
doctor, and all of that. But yes, I pay for it, but I pay like a flat fee for the year, and I
Sure.
can use it as much or as little, and it just depends, right? Like sometimes,
Yeah.
I got little kids, I use it more now than I would have otherwise, but
Yeah.
it's not going through insurance. Is there a way to make that model affordable? Because like maybe that's what I'm paying may not be affordable to everyday Americans, but can you take something like that on a more massive scale and make it so that it does give people literally that personal option, but simultaneously is still in a ballpark that's reasonable?
This is where the free market is chef's kiss. So one of the direct primary
Okay.
care doctors did similar to what you have. They have a subscription based model. You pay a certain amount per month, and that's
Mhm.
what you get all of your care from. The other
Mhm.
direct primary care doctor actually administers it as a fee for service. So every time you go to the doctor, depending on what your issue
Mhm.
is, but she also takes into account what can you pay. She talks about starting her direct primary care practice and folks
Mhm.
initially paying with candles and garden seeds and things of that
Mhm.
nature. And she was more than happy to do that because the way she's worked her business model is it all shakes out in the end. I'm not saying that she's
Oh,
still taking candles and things of that nature, but
yeah.
she also gives doctors and preachers and teachers discounts because they're her best referrals. The thing is, the supply and demand side of healthcare is something that we're not leaning into with models like Obamacare, with models like
Sure.
Medicare for all. We're not letting the spontaneous order of the free market and of people's needs, right? Number one, patients as consumers of healthcare drive our system. When we start doing that, we see these models much better. So direct primary care can look like a number of different things. It can look like fee for service. It can look like a subscription, really whatever best fits the community that you're in. And I will say, hearing these doctors talk about their work and how satisfying it is. And they say
Sure.
we're 24
No,
hours
versus
around the
the
clock.
factory, right? Because I've been to
Yeah.
doctors like that too, and they're churning you through in like 20 minutes, boom, next
Yep.
patient, next patient, next patient. And
Yep.
it's all about then filling out the paperwork, and
Right.
having that front office to do the paperwork and throw the insurance in there, and boom, it becomes like a factory. And nobody really wants to work like that. And it's not the best for the patients. It's not best for the doctors. I get it.
Yeah.
Look, I think it's such an important thing. I'm nervous about it in light of
Yeah.
everything that's going on in terms of the election, et cetera. But I encourage people to kind of be more active. If they want to learn more, I know they can go to personaloption.com. I mean, is there anything else they can do to, start, I guess, pressuring lawmakers to kind of see some kind of grassroots effort to get more opportunity out there for customers of healthcare, consumers of healthcare, not just patients. Let's think of them as clients and customers.
Absolutely. And ideally, most of our medicine would be preventative care, right? We're going to see the doctor before we're always a patient, but we're in that
Yeah.
full debilitated mode that costs the system a lot, costs us a lot, and is really bad for our well being. Personaloption.com, absolutely. And folks can follow me on Twitter at La Stewart Says. I'll be popping off with all
Mhm.
different ways. Anytime I go into my doctor's office and see a sign on the wall that says, if you're here for your, your annual gynecology visit, don't talk about anything
Mhm.
else other than that. Otherwise, you'll be charged more for insurance, and poking holes into why this is wrong, and shedding light on the fact that the health incentives in our system are so backwards and that they don't have to be there. The other thing I would say with folks, ask questions. When you go into your
Yes.
doctor's office for a procedure, for anything, how much would this be if I am self-pay? And really drive that. They might say,
Yeah.
well, I don't know. And you have insurance. I can see your insurance card. Just start asking these questions. It's very interesting to see what you can uncover when something is self-pay, right? Cash is
Sure.
king. And then also check out that Amazon HSA store and start looking around, perking up to things that say, okay, this can be covered under your HSA. There's a amazing company called TrueMed that is working with
Mhm.
businesses who provide things that help with preventative care. So think of like yoga studios, some even exercise gyms that are partnering with them where you can get a letter of medical necessity to pay for these subscriptions, to pay for various things while using your HSA, because at the end of the day, if you're investing in your health now, it works as preventative care. So there's a lot out there. I love talking to you about bringing more light to
Oh,
it and
I love
helping
talking to you
people.
too. Listen, and the viewers love it too. I mean, I see it every single time because people have a thirst for this knowledge, and they do want to be more in control. So they can follow you on Twitter. They can go to personaloption.com. Lauren, so good to see you. Lauren Stewart, everybody, from Americans for Prosperity. We will see you next time.
Thank you.
Again, my thanks to my friend Lauren. Such an insightful interview, and she just has so many cool ideas on how to fix healthcare, which seems so overwhelming, right?